Hello, I'm Dr. Ikioda and I'm the course coordinator for the BA Health and Social Care degree at the Luton campus. I'm a senior lecturer in the School of Applied Social Sciences and my background is in human geography with an interest in health inequalities and digital health. So health and social care is a very, very broad term. It means a lot of things to many people. So the kind of people who come to the course are those who have a general interest in the health of communities, public health, but also have a real need to care for those who are vulnerable or disadvantaged in the community. So this applies to a broad range of people across the life course: children, old people, the disabled, and those who have certain kinds of intellectual disabilities. So if you've got any caring experience or just interested in advocating for the care of people and you really care about health inequalities, this is the course for you. So the course prepares students for three main areas of practice: social prescribing and community development, public health and advocacy, and also health administration. And so this lends to certain kinds of units on the course. In your first year, you get to learn around what the health system looks like in the UK and what social care looks like and how that's different from the health service. You also get to understand a bit about the law and the sociology of health and illness. So what does it mean to be well? What does it mean to be ill? What's the difference between a disease and illness, and so on. In your second year, we introduce you to a much more global perspective around health inequalities. And there you also get to do options around disability, refugees, and other kinds of issues around more intriguing issues around sociology of illness. We also get to think about interprofessional working and what it means to work with other professionals. In your third year, we then prepare you for management, so things around health services planning and how you bring about good outcomes for all service users who might be using your services. Your final year also allows you to write an independent project on an area of interest that really appeals to you. All of this allows you to become a well-rounded individual who's going out there to change and make health better for people in the community. So in terms of real career opportunities that you want to get into, well, there is a huge broad spectrum to choose from. Now, health and social care and the application and thinking about health outcomes for people tends to really be based in local authority. So there are a wide range of public health roles in local authority that you can apply for. So you become environmental health officers, you can become you can work for CQC as an inspector, you can also work in community development and as a community health navigator. And because there's also a very huge need to kind of connect health with social care, you can also work in liaison offices, so as a liaison officer, kind of connecting hospital services with community services. There's also a wide range of opportunities in voluntary services, charities, and social enterprises that are at the heart of advocating for the health of people. Outside of direct work experiences, you can also go into postgraduate study. So what this course gives you is a very good understanding of what health and social care looks like from the perspective of the community. That gives you a very good grounding for things like going into postgraduate study in social work and all kinds of nursing roles. And that kind of leads on to professional qualifications. If you're interested in graduate schemes, we also help you prepare for the NHS graduate scheme and the Department of Health and Social Care Fast Track Policy graduate scheme. So if these are things that appeal to you, do let us know and we're going to support you as best as we can when you're on the course. So why should you come and study with us? Why come and study BA Health and Social Care at the University of Bedford and the Luton campus? Well, first, we have a very eclectic team who are dedicated to research, and we bring our research into our teaching. So you have specialists in disability studies, you have law specialists, you have specialists in mental health, you have specialists in social work, and we bring our very best to our teaching to make it varied, intellectual, and stimulating. So that's really one reason to come. We are good and we're going to help you to be the best that you can be. But also we have a very special scheme in your final year called the Turing Scheme, which is an exchange program where you go to Sweden to also compare and understand what their health system looks like and how that compares with the UK. Students find it a fascinating experience to study another health system and kind of learn from best practices around what we can do to help improve health outcomes here in the UK. So if you want to find out about the Turing Scheme or get to meet our lovely team, please apply and come to one of our open days as soon as you can. Thank you.